Pain Science Part 1, we are talking about the 3 factors of pain. There are more than 3, but these are the most important, from a new book called Pain Science by Dr. Tom Walters, which is actually blowing up right now. He's a physical therapist who talks about how to overcome your pain and what pain truly is. So if you want the link to that, comment down below. I'd be happy to share it with you because the book is awesome and it's easy to comprehend and read. This month we're shifting gears to focus on pain science with 4 different parts. And, this is an important topic because medical professionals tend to kind of push this off to the side and never address it with clients or patients because it's a very complex topic. All right, so with that being said, the first 3 factors of pain, right, in this pain science topic for tonight that we're going to be tackling is number 1, physical inactivity. Number 2 is movement and biomechanics. Number 3 is mental health. So if we rewind a little bit, go back to physical inactivity, the ACSM, which is the American College of Sports Medicine, and the CDC actually recommend that healthy adults engage in about 150 minutes of moderate intensity aerobic exercise. Okay, so like cycling, running, swimming, that type of exercise, or 20 to 30 minutes per day, and that you implement strength and resistance training at least twice per week. That is the recommendation so that you don't increase the sensitivity to pain and that your pain levels don't shoot up. And this is based on a whole slew of research. This is not my opinion. This is based on the CDC and the ACSM. Okay? And research shows that being physically inactive will actually lead to detrimental changes in your nervous and your immune systems. Okay, and why is that important? Because it can increase the likelihood of developing chronic pain. And when I say chronic, I mean pain that you've had for a long time, greater than 3 months. Okay, there's human and animal studies that were done that show that inactivity can lead to increased pain sensitivity. They call that hyperalgesia. Okay, so if someone pokes you and you're not moving as much as the person next to you, it's going to feel like a higher sensitivity, right? You're going to respond more dramatically to it. If you get up from a chair after not moving for a while, you're going to feel it a lot more than someone who moves a little more frequently, okay? So it's important to understand that, and there's studies that show that those kind of inflammatory cytokines, right, tend to increase in humans and animals who tend to move less compared to humans who move more, okay? The good news is that the form of exercise does not matter as much as we originally thought based on the research. So walking, swimming, running, cycling, resistance training, all the way to yoga have been shown to reduce your pain sensitivity, okay? But it is important, if you take anything from this section, it's that you should do 20 to 30 minutes of moderate intensity exercise on most days, okay? And you want to mix in a little bit of strength training about 2 days per week, all right? So topic number 2 is movement and biomechanics. When you're injured and you have acute pain, like you just got hurt last week or yesterday, you need to pay more attention to form, technique, and your training, okay? You need to pay more attention to these things because the more you move and the more you move in an improper position, the more you're going to strain and stress those areas. When you have chronic pain, it's a different story. You don't really need to pay attention to that stuff as much. It's still important. You don't want to neglect it. But with chronic pain, usually your symptoms aren't being as affected by your tissue and your form and changing positions, all right? So as we move on, there are no bad movements, right? Instead of labeling a movement as bad, we need to point out that you should be, or you might be, kind of more sensitive to certain movements than others when pain is present, okay? You might be sensitive to bending your spine. Like a lot of people have pain when they bend over and pick something up, right? If you're one of those people who got hurt, maybe lifting something, and you're more sensitive to bending over and curving your spine, then you want to spend more time in a neutral spine zone position. Okay, maybe you want to spend time stabilizing your spine so you don't put too much pressure on it when you do bend over. And that's just temporary for now. So for most people, to be honest though, it's not really the position of their body or how they're moving that causes pain. It's rather how long they stay in that position for and how much they're moving. Most people tend to not move enough and stay in positions for too long a period of time, and that's what leads to injuries. Right? Movement and exercise are like dosing a medication. It's like the same thing. If you do too much for too long, or if you do too much too soon, you're going to lead to issues down the road. So it's super important to keep that in mind and think about that like a medication, how it affects you with side effects. Exercise can be the same. Okay? You have to kind of taper it down lightly, taper it up lightly. All right? So number 3 is mental health, one of the most important out of the 3 we talk about tonight. Depression and anxiety have been linked to the development of chronic pain. So if you have depression and anxiety and you're experiencing pain, you definitely want to find a mental health counselor who can help you sort through your thoughts and emotions. They can create a plan for you. Even if it's through telehealth, they can meet with you on Zoom like we do with clients through online therapy. You want to address your thoughts and emotions first and get that in check. And if you have good mental health and you're around people who support you and are all about you getting better, you're going to be more likely to recover. And that's why like mindset is so important. And we do some mindset coaching with some of our clients as well. Because if you're in the right mindset, You're going to put in the work, you're going to be more consistent, you're going to feel better while you're doing it, which kind of it's going to help you recover and heal more quickly, and it's going to help your physiology of your body, not just the anatomy and other things going on. Okay, so hopefully that all made sense. I know I went quick. I wanted to keep this short for you guys. Just to recap, we talked about physical inactivity, right? How often you're doing exercises. We talked about the ACSM and CDC guidelines, movement and biomechanics, and then we also talked about mental health. Okay, so make sure you go back and rewatch this. These are the 3 factors of pain you want to keep an eye on. It talks about how they play a role in your level of pain. Did you guys know that we actually have a pain guide on this stuff? And if you guys want access to it, please be sure to kind of like and subscribe if you're on Facebook, like, subscribe if you're on YouTube watching, and comment the word pain down below, and we'll be kind of sure to send that to you right away. And lastly, stay tuned this month for more tips and tricks on pain science. We're going to do part 2 next week, and then 3 and 4 in the following 2 weeks. So thank you guys so much for watching, and we'll see you in the next one.